Hi, everyone. Welcome to Brush Up, presented by Oral Health Group, the dental podcast where we speak with industry experts to discuss topics like technology, finance, and practice management. I'm your host, Dr. Louisa Schultz, a periodontist and prosthodontist based in Fonthill, Ontario. In this episode, we'll be discussing why and how we can decarbonize dentistry. Joining us is Dr. Christophe Bedos, a dentist with a PhD in public health. He is a full professor in the Faculty of Medicine and Oral Sciences at McGill University. In October, Dr. Bedos announced a groundbreaking project that he is leading to make McGill's Faculty of Dental Medicine and Oral Health Sciences one of the first fully sustainable dental faculties in the world. Supported by McGill's Sustainability Project Funds with $54,500, the initiative begins by calculating the carbon footprint of all faculty operations, including several clinics that serve the public. The project measures carbon emissions from every aspect of dental care. From dentist latex gloves to patients' commutes, its aim is not only to inspire global reflection and engage the broader dental community on climate change, but also to drive policy changes for more sustainable practices. Welcome, Dr. Bedos. Thank you for joining us today.
Thanks very much.
During your announcement in October, you mentioned that you wanted to spark a global reflection and you wanted to share findings and engage with the broader dental community to identify targets that we can all set to deal real, sustainable change. What personally and professionally inspired you for this call to action?
I have to confess that 4 years ago, I didn't know anything about this subject. So it's new to me in a way. And I would not consider myself as an expert. I was, at that time, 4 years ago, and I'm still the director of a research network, a Quebec-based research network. We are about 100 researchers from genetics to public health. This network focuses on oral health and bone research. We are subsidized by the government of Quebec, and 4 years ago, the government said, well, you need to reinvent your networks. You need to do things differently. You need to rethink the governance, the strategic priorities, your programs. And there are around 20 networks like this. So at that time, there were 20 networks like this. So then I started a reflection about what the government wanted. And they put the emphasis on addressing major social challenges of our time, or challenge in general for the society. So then I started thinking, what are the main challenges of our time? We know about inequalities, access to care, the population is aging, and that was the pandemic at that time. And then climate change just popped up. I mean, I think we're all now aware of the challenges that we're facing as the humanity, the planet, right? So I started to read a lot during the pandemics, watch webinars, listen to podcasts like this. And then I started to think, well, maybe we need to do something. We need to work on that. And we need to address those issues in a sectoral way. I mean, all of us, all sectors of the society need to work on the subject, not just one, not separately, not in an isolated way. Then I started to look for experts. And in the dental field, I couldn't find any experts in Quebec. So I looked for the rest of Canada, and basically I found experts in Europe. Not that many, actually. It's a new field. It's a beginning field. So that's the way I started to become little by little more, I would say, aware of the situation. And I've been learning tremendously. I feel that I have done a master's in the last 4 years by myself in my house, or watching and reading and developing projects, as you mentioned yourself. I mean, I started, I built a team. I started developing projects. I submitted applications and I obtained funding. funding for several projects, including the one you mentioned, which is to make our faculty sustainable.
So it sounds like it's quite important for all industries, not just dental, to try to decarbonize and think more of our
Yeah.
planet and the environment. How essential is it for dentistry itself to do this? How big is dental's impact,
I
do you
mean, you're
think?
right to
And
mention that all fields of the society need to decarbonize. And actually, Canada committed to reduce its carbon emissions by a lot. A very big reduction is planned for year 2030, I think, based on the Paris Agreement. I don't know if you have heard about the Paris Agreement in 2015 that was signed, ratified by Canada and by basically all countries in the world. So we are committed to reduce our carbon emissions as a society. And of course, the dentistry, like all other sectors, has to do its part. The Fédération Dentaire Internationale, International Dental Federation, emphasized on the importance for the dental field to reduce its carbon emission. So yes, we need to do it. And the healthcare sector in general has to reduce its carbon emission. In Canada, I think the part of the healthcare system is around 5%. 5% of the carbon emissions in our society are related to the dental care, the oral healthcare system in general. So dental care is a part of that, but we need to do our part.
what opportunities or challenges do you foresee for the dental industry in making some of these changes that can have such an important
Well,
impact?
the first I would say is about how do we do it, right? What should we do? Where do we start? And that's the question that I asked myself not that long ago. So how should we start? What do we need to do? How can we reduce the carbon emissions? And first of all, what are our carbon emissions? How much do you produce carbon or greenhouse gases, right? And there is one study that was done in the UK. Some of the people who listen to us may know him because I think he was invited a couple of years ago to the Ontario Dental Association to do a presentation or a workshop, a one-day workshop. Um, but basically, we don't have data in Canada about the carbon emissions of the dental care system. So what Brett Duen showed in England is that the main source of carbon emissions related to dental care is transportation of the staff, transportation of the patients, around 1/3 for each part. So 2/3 of the carbon emissions are related to transportation, which gives you an idea of the amount of greenhouse gas emissions related to dentistry, considering that actually we think, and most people think that waste, plastic, is the most important thing. And actually, it's according to Brett Duen's study, it's just a tiny part. The plastic is a tiny part of the problem. I'm not saying that it is a minor issue, though. We agree on that. I mean, we know that plastic is everywhere. I don't know, there are 110 billion tons of plastic in the oceans, right? There is a continent of plastic between Japan and Alaska, the size of Quebec. So we know that plastics are huge issues. We basically drink and eat plastic every day in our food because there are microplastics everywhere. So we need to reduce our consumption of plastic. We need to do better. But the transportation is even much better than that. So it gives you an idea of the amount of pollution that we as, I mean, I would say, as a civilization, Western civilization, we pollute a lot.
Compared to some of these other known to be really high emission sectors, like steel, or I think production of food has
Oh yeah,
also kind of been a culprit
yes.
when we talk about carbon emissions. Are there other areas in dental sector that we would have other opportunities for? How urgent
Well, you
is
have
it
your
we make
procurement. I
these
mean, according to the
changes?
study that was done in the UK, and we'll see at McGill. I mean, because we will do the same study at McGill, so we'll soon know. And maybe you'll invite me, and I will share with you the findings about us in our faculty. But according to Brett Duane, the purchase of equipment was equivalent of around 19 or 20% of the carbon emissions. And then you had electricity and gas consumption. So when you want to, in winter, we need to be warm in our dental offices, so we need to use the electricity, etc. And I would say then you had waste. Waste was less than 1%, according to Brett Duane. So basically, the equipment we buy, the frequency with which we renew our equipment, the frequency of our purchases. If we order something every day, so that means that a truck will come to our door and bring something. So if it's a small package, the transportation, maybe we could regroup things, right? Instead of purchasing all the time, maybe we can do bulk purchasing, things like that. So yes, procurement is also an important issue, and where the products come from. If you order something that comes from China, of course, the carbon impact will be high. If it is produced in Ontario, in Toronto, well, maybe the carbon emissions will be less important.
Thinking about the people that come in sometimes to do maintenance work as
Absolutely.
well, and their transportation
Absolutely.
is another factor. What practical steps do you think dentists can start making now to have a more sustainable practice?
I would say the first thing they can do is ask to be trained, because they cannot invent things. We cannot ask people just suddenly to say, okay, I'm gonna do better. Of course, I think many people in many clinics are sensitive, but they don't know what to do. How do we reduce our carbon emissions? What is useful? What is less useful? What can we do better? Does it increase the cost of the functioning of the clinic? Do we need to invest? So clinics may need some help as well if there is a decision to decarbonize. Maybe clinics will need some support. So, and the first support is training, and we need to develop training. And actually, at McGill, we are developing an online training, 3 hours. It's going to be in French and English. It's going to be free, so we don't want to make money with that. So, in a couple of, maybe in 1 year, it's going to be free. So I will invite people to take this, to follow this training if they want to. And we'll try to develop more advanced training, maybe on site in dental clinics. I think we could have teams of trainers coming into the clinics and showing how the clinics and all the staff in the clinic, because it's not just one person in the clinic. It's the dental hygienist, the dental assistant, the front desk personnel. It's also informing the patients. It's also informing the companies that provide us with equipment and material. It's a global approach. It's a global partnership. But yes, the first thing would be the dentist and the workforce should be trained better. They could ask the government to support also the development of free training.
Yeah, it sounds like the first step when we have a problem is recognizing the problem, which you clearly and I think worldwide many people have recognized
Yeah.
that this problem exists. And then, yeah, learning more as your studies seem to want to do, learning more about where that problem lies, and then understanding how we can change what we do on a day-to-day basis at all levels, schools, practices, dental industry, how we can all come together and do our part. But it sounds like we also need to drive our government to make some policy changes and other things that can help
I
at a
completely
national
agree.
and global
I think
level.
that's essential. I think it is essential that we work at the global level. I think the governments need to take the lead somehow. And if they don't take some leadership, we need to push them towards that. We should not put all the responsibility on the shoulders of individuals, right? Small eco practices at home, etc., is good. But let's not put the blame on the citizens. Let's not put the blame on dental professionals. Of course, everyone needs to be involved, but upstream approaches are imperative, I would say. We cannot change society without strong policies, directions, and support for those who will make the change.
I remember as a kid being taught, don't waste the water, turn off the light when you leave the room. And I think these are things we keep on doing, but what we do, things like this as individuals, is just not enough anymore. We have to come together as a society, as a dental community, and work together to have bigger goals.
Absolutely. And I would say dental organizations, professional organizations, in my opinion, should be highly involved. They should be leaders. They should promote that change at all levels. And they should put pressure also on the government to go faster. And I'm afraid to say that the Accord de Paris, the Paris Agreement, is ambitious in some ways. But if we want to succeed, we need to act right now, and we need to do better. We need to do much better at the level of the society. At the moment, our carbon emissions are not decreasing enough, really. Our carbon emissions as a society decreased during the pandemic, but they should decrease in the same way for the next decade. So we need to really need to act vigorously and do things that may be difficult. Decisions will be painful sometimes, right? And all of us will need to reflect upon the way we live and the way we consider the planet.
Yeah. Not making these changes will be more painful in the long run, right? It's a momentary pain to adapt to the changes.
Yeah, and I would say, because I think, at the end, I think it's important to reflect upon us as a society, the fact that we have been using the resources of the planet in a way that is, I would say, incredible in some ways. Because, for instance, let's see oil. Oil has been discovered not that long ago, right? Fossil fuels in general. I would say 1 century ago, that's when we started using oil, a bit before. And then in basically 1 century, we have used more than half of the reserve of oil in the planet. So, and it has allowed us to do so many things, to grow, to have so many, our clothes, right? Our clothes, our cars, our houses. But then we have been depleting the planet from that. What about the next generations? In 1 century, there won't be oil anymore. How come we accept that? How come? I've reached an age where I think about my son. He's 20. What will be my legacy to him? I want to give him much more than what I received from my parents. That was my goal, and I think I may succeed in that. But then I just realized a couple of months ago that actually he will inherit a planet that is in such a poor state. And if I had to compare my situation in this situation, I think I was much more privileged than he will be. Because when I was born in the 1960s, the planet was in a much better state. The pollution was much less. And we will give a legate a planet that is in a poor state, and we have been depleting the resources. We have been using oil, but now it's rare metals for the green transition. And the question is, can we slow down? Can we slow down a little bit with this, in some ways, predatory approach towards the planet? We are predators. We're just taking all the resources as if the next generation would not need those resources. And we expect the next generations to be smart enough to invent strategies to find out ways to manage without those resources. Let's do it
Let's
now.
do that
Let's
now.
let's go down now. And I think that
Yeah.
we are all citizens. We are professionals, but we are also citizens. We are parents most of the time. We may be grandparents. So what will happen to the kids of our kids and the kids of our grandkids? What will happen to them? And I think we need to think about it right now, because what we do now will have an impact in the future. When we emit CO2, carbon dioxide in the atmosphere, the CO2 we emit now will stay in the atmosphere for around a century. So what we do now has an impact on our grandkids. So I think we need to keep this in mind. And overall, we're all together on the planet. We need to work together, and we need to really accept to criticize ourselves. I mean, as I said in the beginning, 4 years ago, in a way, I think I was blind, but okay. I mean, I think it's never too late. I don't understand why I didn't see things like that. Now I have a way. I mean, it changed me as a citizen myself, as a human being. I'm different, and I'm facing challenges and guilt. I must say, in many ways, it's not easy to be self-critical, to reflect on what I have done. Let's say. But at least let's do something now. Let's work for us, but also for the next generations. Let's try to make the planet good for them.
You were mentioning as you were learning about sustainability worldwide and wanting to enrich yourself with that knowledge, that you didn't really find any experts in America, that you reached out to Europe and other countries, UK, Sweden, Germany. They've already been making some changes, investing in research. You're mentioning that this other dental clinician that
Yeah,
even came to Ontario and gave a lecture a few years ago. Where are we in Canada? What have we done so far? Is there anything they are doing that we can easily implement
I would say
here?
they're more advanced a little bit in the training, but not that much. Not that much. I have been contacted by people in the US, uh, Australia, even France, saying, "Well, we would like to work with you uh, because
Mhm.
we are isolated. We are starting. We lack knowledge." So I would say that they're not that much advanced. So much needs to be done. And I am the co-director of this Quebec Research Network, and we will put money as a as a funding agency. We will put money on developing teams that work on sustainable dentistry. I think research is important to develop new approaches, new materials, to evaluate those approaches, to see if they work well, also to promote the implementation of new approaches. But they are not that advanced. Uh, I would say that
Mhm.
they have been maybe more sensitive earlier than us. They have started developing knowledge earlier than us. Brett Duane, for instance, in the UK is more advanced in terms of knowledge, but is somehow isolated as because it's a new field. That's why I think all need to work together and share the information. We need to share the knowledge, our expertise, and actually, I invited Brett in my research project. So we submitted grant applications. He's one of my co-researchers. And there are organizations at the level of Canada for the healthcare system. I would say dentists are not necessarily well advanced compared to physicians, but I think we are all at the beginning. Um, Lots need to be done, but I think things can go faster as when we start grouping or regrouping. Um, so, for instance, I am currently with French people. For instance, I'm currently developing a carbon calculator for dental clinics. So we are putting this into function. Hopefully we will have it ready within a couple of months, maybe weeks, who knows. So it will be free also to use for the clinics, just to see how much carbon emissions they produce. But again, we need to have training. We need to give support to the clinics to be able to implement things. And we need to work with the industry as well to develop products that are sustainable, right? So that means partnership also with the industry. So all together, we need to work on that.
Thank you so much for your time, Christophe. This has been a really enriching conversation for me, and I hope for the same for our listeners. Thank you to our listeners for joining us today. Thank you so much for listening. Be sure to sign up for Brush Up podcast alerts or subscribe on Spotify and YouTube to be notified every time we post a new episode. Keep brushing up.